It really depends age-wise. Basically, this melanoma is the second in line of life years lost for patients that are in their 20s and 30s. It seems that the younger the patients are, the burden of loss is a lot more, obviously. And their prognosis when you do have melanoma at a younger age is very grim. In addition to that, just as a statistical fact, one person dies of melanoma every hour, which that is something that growing up always smoking was associated with how many people are dying. And you never thought, a skin cancer, definitely melanoma, there was such a high prevalence of it. But there is. They project that in just this year, there will be about 9,700 patients that will be diagnosed with melanoma. So the burden is quite high just because I think of more screening, more vigilance, and more exposure, people knowing of melanoma and cancers. So you're seeing it more and knowing people died of a melanoma and years lost from it. Obviously, the staging of melanoma is basically you have stage 0, which is really nothing, but stage 1 through 4. And the prognosis, patients who are in stage 1 usually have about a 5-year survival rate of 95%. And as the staging goes higher, obviously, it's multifaceted, but as the staging gets higher, definitely it's lower and lower. So if patients have stage 2, it goes anywhere from, depending on involvement of ulceration and whatnot, it will go down anywhere from in the 70 percentile. Patients who have nodal involvement, which is patients who are in stage 3, it can go down anywhere from 50 to 35%, 25%. In patients with stage 4, it is basically definitely closer to like 19% and below. So obviously, it correlates. As the stage is higher, the burden of it and prognosis is worse. And all these prognoses are like 5-year survival rates based on the staging. It depends really also age-wise, because when you have patients that are younger, they may have just a mole, which is a stage 1. It may be removed and there's no reoccurrence, but tends to be younger and depends if it has, if it's ulcerated or not, and that can increase within a year. So there's patients who are diagnosed, but they are not diagnosed until they have like a stage 3. So that prognosis is very grim in the sense of going from stage 3 to stage 4 may take not a lot of time. It also depends on the kind of melanoma that they have. There's also genetic profiling that's done, and those factors do help in therapies that are available and how long those therapies are durable and if they can move up staging. So, but there are patients who, from the aggressiveness of their individual disease, it could be a year, but there's patients that we have that have survived melanoma. They were stage 3, stage 4, and they're not disease-free, but they have stable disease for the past 4 or 5 years. Therefore, it really depends also when they were diagnosed with melanoma. So patients that were diagnosed 10 years ago and there were minimal therapies available, they went from one stage to this next within no amount of time. Now, based on the fact that we have all these new therapies, we are delaying that process. So it really depends on the patient population. You're looking at the age of the patient, how aggressive their particular disease is, and also when they were diagnosed with melanoma and what therapies are available at that particular time. So the question is hard to say from stage 1 to 2 how long it would take. Usually from stage 1, not necessarily are you going to go to stage 2 because the survival rate is very good. It's 95 to 98%, and it may never reoccur. Patients who are stage 2 and do have ulcerations and may have some complications, it really depends. But patients with stage 3 and 4, it could be months, it could be years. It really depends. It has significantly changed the paradigm because before you had dacarbazine, you had a handful of drugs that worked for melanoma, but really there was no long-term benefit. People were not surviving. The survival rate now with immunotherapy has somewhat, the overall survivals with things like Yervoy that have come, that was the first in 2010, followed with Keytruda, followed with Opdivo. All of those medications now, and they're all immunotherapies, all have changed the paradigm completely because those are first in line that are used as opposed to the chemotherapies that were originally and the only thing available for patients who had melanoma. So there's a complete shift in how patients are treated. So first in line would be immunotherapies as opposed to the old dacarbazines and things of that nature that were quite harsh on patients too, not just durable response. And the rates, overall survival, progression-free survival has significantly changed from having immunotherapy available for patients.